Good afternoon. I want to thank all of you for joining us here today for the 2023 Richard and Barbara Hansen Distinguished Lecture. For those of you who don't know me, I'm Edith Parker. I'm the Dean of the College of Public Health, and I'm really delighted to welcome everyone to today's presentation. I also want to welcome those of you who are joining us remotely and just let everybody know that today's lecture is going to be recorded and will be available through the College of Public Health website after today's events. The Richard and Barbara Hansen Award is our college's highest honor. For the past 22 years, the Hansen Award program has allowed the college to recognize a national leader who's made outstanding and sustained contribution to advance the field of public health. And it also gives our students, faculty, staff, and the broader community an opportunity to interact with these distinguished leaders. Before I introduce today's distinguished guest, I want to take a few moments to acknowledge a very special couple who generously endowed the Hansen Award. Richard and Barbara Hansen of Iowa City. Sadly, the Hansens both passed away within a few weeks of each other this past year. Dick and Barb were among the earliest supporters of our College of Public Health and our very first founding partners. And over the years, they remained devoted friends and advisors to our college and to the broader university community. Their gift helped shine a light on the critical role of public health in our society, the values and impact of our discipline, and the importance of bold, courageous leadership in this field. Their contributions and spirit will live on through the Hansen Award in years to come. Now, the list of Hansen Leadership Award recipients includes some of the foremost leaders, advocates, and agents for better health and a more equitable society. And this year's recipient, Peggy Shepard, certainly adds to the distinction of this prestigious group. Peggy is co-founder and executive director of WEAC for Environmental Justice, which is a community-based organization in northern Manhattan that focuses and has been instrumental on local and national efforts to advance environmental protection and environmental health policy. She has successfully combined grassroots organizing, environmental advocacy, and environmental health community-based participatory research, and has become a national leader for environmental policy and the perspective of environmental justice in urban communities. Her work in this area has been motivated by a desire to ensure that the right to a clean, healthy, and sustainable environment extends to everyone. Shepard co-chairs the White House Environmental Justice Advisory Committee and co-chairs the New York City Environmental Justice Advocacy Board. In addition, she was the first female chair of the National Environmental Justice the National Environmental Justice Advisory Committee to the U.S. Environmental Protection Agency. She also serves on the executive committee of the National Black Environmental Justice Network and the board of advisors of the Columbia Mailman School of Public Health. Peggy has been awarded the Jane Jacobs Medal from the Rockefeller Foundation for Lifetime Achievement, the Heinz Award for the Environment, the William K. Riley Award for Environmental Leadership, the Knight of the National Order of Merit from the French Republic, the Dean's Distinguished Service Award from the Columbia Mailman School of Public Health, and honorary doctorates from Smith College and Lawrence University. On a personal note, I've been honored and fortunate to know Peggy since the late 1990s when we were both involved with the National Institute for Environmental Health Sciences, EPA, Children's Centers. I consider her to be a mentor to me and to many others in the area of community-based participatory environmental health, and a true example of the power of community and community academic research partnerships. So it's with tremendous pleasure that I welcome Peggy Shepard, and I really look forward, as we all do, to hearing your remarks entitled Advancing Environmental Health, Justice, and Equity. Peggy?
Well, thank you so much, and good afternoon to all of you. It's really been an incredible opportunity to dialogue with so many students and faculty during my time here, and it's really my honor to receive this Richard and Barbara Hansen Leadership Award. I want to thank Dean Edith Parker, who I've had the privilege of meeting so many years ago when she was at the University of Michigan Children's Environmental Health Research Center. Now, as a grantee back then of the NIHS Children's Center program, I really had the opportunity to engage with Dean Parker and other environmental public health champions. And it's really those interactions that contribute to my passion to stay the course on helping to achieve healthy, safe environments for the millions of people in this country who live in the wrong zip code, who live in sacrifice zones. Now, my organization and other advocates have been supported in these efforts through our 23-year partnership with Columbia's NIHS Center and the Columbia Center for Children's Environmental Health, where WEACT has been contracted to translate the environmental health research findings to community education and policy change. Now, data from the partnership has contributed to a number of issues, to transforming the entire New York City diesel bus fleet, the largest in the nation, to hybrids and electric, as well as contributing to legislation on pesticide notification, a ban on BPA and toxins in children's products at our state legislature. This honor also acknowledges the work that I've led with my team at WEACT for Environmental Justice as we celebrate our 35th anniversary of organizing and engaging the communities in Northern Manhattan, which means East, West, Central, Harlem, and Washington Heights, Inwood, really working in those communities to advance environmental and climate justice. We also observed nearly 15 years of operating a federal policy office in Washington, D.C., that convenes the Environmental Justice Leadership Forum, which is a network of 55 organizations, grassroots organizations around this country. And we continue to be the only environmental justice office in Washington, D.C. Now, our goal is really to ensure that the perspectives and the concerns are heard in Congress from grassroots organizations and considered by the Biden administration. Why? Well, because the environmental justice vision, the big idea here is to expand democratic space for all of our voices and perspectives to be heard and incorporated into solutions that create safe, healthy, and sustainable communities for all of us. Now, the challenge that I have embraced is that all residents should have access to clean water and clean air, equal environmental enforcement and protection, and equitable land use and zoning. Now, these are the dynamics that have really galvanized my attention, energized me, and challenged WEACT over the past 35 years to create that power shift that amplifies the voice of affected residents, to really mold and infuse public policy with their expertise, their passion, their sorrow, but their solutions as well. Now, WEACT's theory of change is to organize and inform the most affected residents to engage in environmental policy and decision-making. We've worked with community residents and our 1,000 members to really identify the key factors of a healthy, sustainable community that my organization can address. And just to name some of those factors: clean air quality, climate change, energy security, healthy indoor environments, sustainable land use, solid waste management, reduced access and use of toxic products, access to good food, safe, clean, affordable transit, and the creation and use of parks and open space. And these are the 10 elements that the community has told us help them to create a sustainable community. Now, in talking about environmental justice, the environmental justice movement, it's an environmental, economic, and social justice uprising. It's a dynamic that has redefined environment to where we live, work, play, and go to school. It's a civil rights analysis of environmental decision-making with a focus on the permitting process, the process that gives government agencies and industries permission to pollute. And this permit is an allowance to sacrifice people and their health. And we're all clear that it's not behaviors alone that lead to health disparities, but also the amount of pollution that's emitted in close proximity to where a person lives, works, learns, and plays. Now, this activism, according to the American Bar Association, has won passage of key climate and environmental legislation in 35 of 50 states in this nation. And this grassroots work has really catalyzed environmental justice programs at universities, the publication of hundreds of books and case studies, and created environmental justice advisory councils in city, state, and federal agencies. Yet, environmental nonprofits have received minimal philanthropic support for our successful advocacy in the face of David versus Goliath struggles. And our work has been the only support for hundreds of neighborhoods and communities on the front lines of pollution, disinvestment, and environmental degradation. We know that studies show that people of color, and Black Americans in particular, are subjected to But not only is this true for air pollution, but also for other sources of pollution. In fact, Black people are 75% more likely than other populations to live near a facility that produces hazardous waste. And the worst example of this is Louisiana, where an 85-mile stretch along the Mississippi River between Baton Rouge and New Orleans has come to be known as Cancer Alley. And here there are close to 150 petrochemical plants emitting toxic chemicals linked to cancer, such as benzene, chloroprene, and these are located in predominantly Black and brown communities, an environmental sacrifice zone that produces 25% of the petrochemicals in the United States. And the cancer rates in some of these communities are 50 times higher than the national average. Now, the cumulative impacts of all these chemicals likely contributes to these significantly higher cancer rates. But unfortunately, as of now, the EPA does not take into consideration the cumulative impacts of the emissions from these plants, as they currently only regulate individual pollutants plant by plant. So to address this issue, WEACT has contributed to the passage of a cumulative impacts law by the New York State Legislature, the first one being in New Jersey. And we did this because New York's laws and regulations do not take the cumulative impacts of pollution to account when approving the permits for these facilities, instead treating them as if they were the only source of pollution that residents would have to endure. Now, this new cumulative impacts law changes that, and it's widely recognized as the landmark legislation in addressing environmental racism that has really plagued the health and well-being of so many communities for generations. Now, to that point, a Harvard study has found that Black Americans living in areas like Harlem and the South Bronx, which do not meet clean air standards set by the EPA, died of COVID-19 at higher rates than others. Now, that's not a surprise because the majority of Latinos and Black Americans live in areas that do not meet clean air standards. So WEACT is, for all of these reasons, had a pretty aggressive policy agenda. We've contributed to the passage of a New York City local law, 154 of 2021, known as Gas-Free New York City. It mandates that new buildings in the city under 7 stories will be required to be all electric beginning this January, and those over 7 stories beginning in 2027. This is also a major win because it prevents the burning of fossil fuels in new buildings, including gas stoves, water heaters, and boilers, which accounts for around 70% of New York City's greenhouse gas emissions and emissions of particulate matter. And we know that burning fossil fuels in buildings isn't just bad for the environment, it's bad for our health. It contributes to respiratory and cardiovascular illness. And in fact, more than 1,000 New York City residents die prematurely every year from pollution from burning fossil fuels in our buildings. And communities of color are exposed to 17% more air pollution, with Black communities being hit the hardest, breathing in 32% more particulate matter than their counterparts. Now, ensuring that future buildings won't burn fossil fuels is a major step forward, but what about all the existing buildings? How do we get our existing buildings to transform from fossil fuels to electricity? And how do we replace the gas stoves with electric induction stoves and the boilers with electric heat pumps? Now, to better understand how we can do this equitably, we conducted a pilot study with Columbia, with the Rocky Mountain Institute, and the study was called Out of Gas, In with Justice. And it replaced gas stoves with electric induction stoves in a public housing development in the South Bronx. And this study was the first in the nation to monitor indoor air quality in homes transitioning from gas stoves to induction stoves with residents in place in affordable housing. And what did we learn? Well, for starters, we learned that people who try induction stoves quickly fall in love with them. At the end of the study, none of the participants, all who were Black and Latino, wanted their gas stoves back. And everybody in the control group wanted to replace their gas stove with an induction one. And some of these folks tried these stoves over Thanksgiving last year and were able to cook much more quickly and efficiently. In fact, one tenant leader said that every time with her gas stove she had walked into the kitchen, she was coughing more. And that, again, that symptom has disappeared with the electric stove. We also learned that while this transition is essential to reduce building emissions in order to address the climate crisis, it's really an issue of public health. And we saw a 35% reduction in daily nitrogen dioxide emissions compared to homes still using gas stoves. And in fact, nitrogen dioxide concentrations in homes with gas stoves exceeded the EPA's outdoor air quality standards. Now think about that for a moment. Using a gas stove can exceed EPA air quality standards for the outdoors, and this is in your own home. A recent study led by Stanford found that gas stoves emit benzene, a known carcinogen also found in cigarette smoke, along with other pollutants like nitrogen dioxide, carbon monoxide, and formaldehyde. The researchers found that the benzene levels were 10 to 25 times higher in homes without a gas stove, and that these dangerous emissions migrated throughout the house. In some cases, benzene concentrations above the chronic health benchmarks were found in the bedrooms of these homes hours after the stove had been turned off. So we are now exploring ways to equitably achieve this transition from gas to electric, working at the city, state, and the federal levels. And we're also working to ensure that the electricity that will power our homes comes from renewable sources. But pollution from appliances that burn fossil fuels is not the only source of indoor air pollution. And, you know, indoor air pollution is an overlooked threat to our health, given that we spend around 90% of our time indoors, especially children and the elderly. And in low-income communities and communities of color, the housing stock is typically older, poorly maintained, and as a result, many families are living in homes with mold, which can impact respiratory health as a result of water leakages, but also flooding due to extreme weather events. Now, New York State leads the nation in the number of homes, an estimated 5.3 million, built before it banned lead paint in 1978. And as a result of this prevalent threat of lead exposure, which in New York City comes primarily from chipped paint and construction dust, the state also leads the nation in the number of cases of children with elevated blood levels. Children of color are disproportionately impacted by lead poisoning. We know they suffer lifelong health effects, including serious neurological and physical damage that results in permanent learning difficulties, hearing loss, behavioral issues, lowered ability to concentrate, and impaired academic performance. And lead in soil obviously is more common in the Midwest as a result of lead smelters and other manufacturing facilities. So as a result, in New York State, we passed legislation, New York City's local law 1 of 2004, one of the most protective in the country, that requires all landlords to inspect for lead and remediate if necessary whenever a tenant vacates an apartment. Now that was nearly 20 years ago, yet more than 2,500 New York City children still test positive for elevated blood levels as recently as 2021. Why is that? Well, a lack of inspectors and enforcement. In other words, a lack of political will to protect our children. Now, we've also been working to get toxics out of cosmetics and other personal care products. You'd be shocked to know, or maybe not, how little regulation this industry actually receives. Phthalates, formaldehyde, and mercury, just to name a few, of the more than 50 toxic chemicals commonly found in beauty products that people use every day, women and men, because we're talking about the lotions, we're talking about any of those personal care products that you're putting on your body. We know that phthalates are endocrine disruptors, interfering with our hormones, which makes exposure particularly dangerous for children whose bodies are still developing. And of course, we can see our kids putting on lipstick, putting on fingernail polish, sitting in nail salons with their mothers, and of course, breathing in really polluted air. We know that this leads to an increased risk of asthma, some say autism and hyperactivity, as well as impaired reproductive development. We know that further studies are needed as we're just starting to understand the scope and the potential dangers of this cumulative exposure to phthalates. We also know that formaldehyde is found in many of the hair straighteners used by women of color, especially women from India, from Asia, from the Caribbean, especially use these kinds of products. Again, highly toxic. These products have been linked to an increased risk of uterine cancer. I think a number of studies have come out in the last 4 months to that issue. And then mercury, which of course is a dangerous neurotoxin, is often used in products marketed as skin lighteners. And again, these skin lighteners heavily used by people from the Caribbean, Africa, Asia. And so again, we also find that even as we ban some of these products here in this country, they continue to be brought in by folks visiting other countries or ordered online. So it's been very difficult to really rid ourselves of mercury in so many of these products. I know the New York City Department of Health has had every now and then an initiative around this, and I was able to go outside of my office in my neighborhood and find products that actually had the word mercury written on the ingredients in some of these kinds of products. So again, it continues to be a really important problem. I'm proud to report that we have banned mercury from these products in New York, and our Director of Environmental Health helped lead an effort at the United Nations conference in Geneva last week for a global phase out of mercury in these products by 2025. So we've been doing this work as part of our Beauty Inside Out campaign. We've been working closely with our longtime colleagues at the Columbia Mailman School of Public Health. And really similar to the disparate exposure to pollution connected with cancer, the reason for the higher morbidity is really driven by inequities in everything from access to healthcare, lack of insurance, discrimination and bias within the healthcare system, and all of that, again, rooted in systemic racism. So I'll share a few statistics. 61% of Black folks and 70% of Latinos live in areas that fail to meet air quality standards as set by the EPA. Black people are almost 3 times more likely to die from asthma-related causes than the white population, and Black children are 10 times more likely to die from asthma. And while income is a factor, race is the most significant factor in determining how much pollution you're burdened with. For example, studies show that a Black family with an annual income of $87,500 is likely to live with more pollution than a white family making $22,500 a year. And, you know, often in the early days when I would talk to college students, they would say, oh, it's really not race, it's really income, isn't it? But no, we know from so many studies, it is really not income. It is definitely race. So, you know, as a result, advocates for environmental justice really place human health at the center of environmental struggles, because we know that our physical environment and the zip code in which we live are 2 of the most important determinants of our health. We also know that this environmental justice crisis results from a really complex legacy of housing segregation, land use and zoning discrimination, and inequitable environmental law enforcement. Systemic and institutional environmental injustice results in this disproportionate exposure to environmental hazards and polluting facilities, which really contributes to health disparities and shortened lifespans. And now there's growing evidence that this isn't a coincidence. In the early 20th century, local and federal officials, usually white, enacted policies that reinforced racial segregation in cities and diverted investment away from minority neighborhoods in ways that created large disparities in the urban heat environment. And the consequences are being felt today. In the 1930s, the federal government created maps of hundreds of cities, rating the riskiness of different neighborhoods for real estate investment by giving them grades. Black and immigrant neighborhoods were typically rated hazardous and outlined in red to imply that they were not a suitable place to invest and lend money. So for decades, people in red line areas were denied access to federally backed mortgages and other credit, which of course sparked a cycle of disinvestment. The New York Times reported on a study that found that formerly red line neighborhoods are today 5 degrees hotter in summer on average than white areas, which were the ones favored for housing loans. And some cities are even seeing differences as large as 12 degrees between those communities. Red line neighborhoods, which remain lower income and more likely to have Black or Hispanic residents, consistently have far fewer trees and parks that help cool the air. They also have more paved surfaces, such as asphalt lots or nearby highways that absorb and radiate heat. And every Black neighborhood, no matter its income level, was outlined in red and deemed a hazardous area for housing loans. The redlining maps really deepened the patterns of racial inequality in ways that have lasted for decades. White families could more easily get the loans and federal assistance, building wealth to pass on to their children. When Black soldiers returned home from the war, the GI Bill sent waves of white soldiers to college and gave them subsidized mortgages to be able to buy a home, but Black soldiers had no access to those benefits. So neighborhoods with white homeowners had more clout to lobby city governments for tree-lined sidewalks and parks, and Black neighborhoods home ownership declined, and landlords rarely invested in green space. City planners also targeted redline areas as cheap land for new industries, highways, warehouses, and public housing, again built with lots of heat-absorbing asphalt and little cooling vegetation. Disparities in access to housing finance really created a snowball effect that compounded over generations. And Congress finally outlawed redlining by the 1970s, but the practice has left lasting marks on our cities. Now, we know that climate change and health is an emerging field of study, and we're addressing climate change and health in several ways. While people may not be familiar with the term climate justice, their overwhelming support for just solutions to the climate crisis really gives me hope as we pursue solutions at the city, state, and the federal levels. We work on extreme heat because 50% of heat-related deaths in New York City are Black African-American folks, even though they make up only 25% of the city's population. Now, New York City may see an average temperature increase of 5.7 degrees Fahrenheit, including a doubling of days above 90 degrees by the 2050s, according to the New York City Panel on Climate Change. So we understand that communities experience environmental degradation and pollution exposure in diverse ways, depending on the region of the country and their zip code, which is a major predictor of health status and environmental quality. In urban areas, mobile sources and abandoned contaminated sites are really a key challenge, where local governments generally manage the infrastructure of pollution. But in smaller cities and rural areas, there's a proliferation of industrial and petrochemical facilities, mining and extraction, landfills and incinerators, and combined animal feed operations known as CAFOs. And in places like Texas and California, there are few to no zoning laws that separate industrial facilities from residential neighborhoods. In California, you can have a cement operating plant next door to your house. No zoning, really key problem there. I also learned from visiting colleagues in Houston, where I saw the Latino community living fence line to diesel emitting ships and trucks moving to and from their ship channel. And these families experience pollution burden from toxic air particles that's 50 to 60 times that of the broader Texas region. Now, there's a song popularized by Nat King Cole called Unforgettable. And that's what Cancer Alley is, unforgettable in the worst possible way. This 75-mile corridor between New Orleans and Baton Rouge is a continuum of petrochemical and plastics manufacturing facilities on acres of former plantations. Now, small communities of a few hundred people are sandwiched between these monstrously large facilities, which do not employ the Black residents whose health has been impacted by their operations, which have created an intergenerational history of death from cancer, including some communities suffering cancer rates 50 times higher than the national average. In North Carolina, the concerned citizens of Tillery took us on a tour to understand how industrial-sized hog farms impacts the health and well-being of nearby residents. Why? Because the waste of thousands of animals is applied to fields through a spray that is an eye and respiratory irritant, and this spray covers nearby homes and infiltrates their drinking water, which comes from wells. I also know that, and have found out today, and I'll be advocating around Iowa, that you have a huge CAFO situation here with hog farms as well, perhaps the largest in the country. So again, you understand these issues. We also know that around the country, Native American and indigenous coalitions are fighting pipelines that have the potential to undermine water quality and sacred sites. In Alaska, a respected elder from the Gwich'in tribe at the Arctic Circle implores us to oppose oil and gas drilling in the Arctic National Wildlife Reserve, where the migratory route of the caribou, their main source of food, clothing, tools, and their way of life, will be endangered. And of course, we know that labor is very eager to get back to drilling in the Arctic. Now, the Biden administration, they've committed to centering environmental justice in all government policies through Justice 40, and also through an executive order that directs at least 40% of the overall benefits from federal investments in clean energy to go to disadvantaged communities. So there is an opportunity to implement a transformative and an accountable process for the fair and just distribution of the benefits of Justice 40 to go to frontline communities of Black, Brown, and Indigenous peoples. But how do we make certain that those investments and benefits reach the frontline communities that they're intended for, given the bias and the ambivalence of so many state and local governments? So that's been my mandate as co-chair of the White House Environmental Justice Advisory Council, which is known as WEJAC. But at the same time, when we have the Biden administration centering environmental justice, they are still providing billions of dollars. Well, I should say Congress is providing those funds and the administration has to administer it. And they are providing funds for carbon sequestration, which will mean more pipelines throughout our communities. Again, more monies for direct carbon capture from smokestacks, which gives another ability for a revenue source from our petrochemical and oil companies. So again, in one hand, we're making steps forward on environmental justice, and on the other hand, we're taking steps back on really having a just transition from fossil fuels to renewables. So it's obvious that schools like yours have an opportunity, an important role to play in this fight for environmental justice. You all have the scientific expertise to identify sources of pollution, connect them with adverse health impacts, and to work with community-based organizations to really provide the data that they need to be strong advocates around these issues. Community-based organizations like mine at WEAC can really help identify issues worthy of research, provide ground truthing of concepts, help share the studies with communities that are directly impacted, and then we can advocate for policies and programs to address the issue. We realize that we have now arrived at an inflection point for the national environmental justice movement. A lot of that due to the murder of George Floyd, when philanthropy and governments began to understand that their lack of investment in communities of color have created these gaps of investment and attention. And so we have arrived at an inflection point for the movement as government and the public realize that the most powerful factors shaping health and disparities are social, racial, economic, and environmental exposures, and of course, increasingly climate change. So Hippocrates, the father of medicine in the 5th century BC, said, if you want to learn about the health of a population, look at the air they breathe, the water they drink, and the places where they live. And I know that's what you all are doing here at the School of Public Health. I applaud you and thank you so much for inviting me to be able to provide some comments and also to learn from you. I've learned a lot today, and believe me, I will be using that in my advocacy every day. Thank you so much for inviting me.
Thank you so much. That's such a wonderful, wonderful talk, but more importantly is all the work and leadership that you've shown throughout the country and actually the world. So we're just honored to have you. And Peggy has graciously agreed to take questions from the audience. So if you if you're in the audience and you want to ask a question, if you could just write it on your card and pass it up. If you're online, if you can use the Q&A function in the computer, then that would be great. Oh, here's one. So here's a question. What should be our community's highest priority that we can tackle at a local level to address environmental racism here? In case you're a visual.
So air quality and water quality are just key to life. And it seems to me that those would be priorities. You are a farm state where you have exposures coming from pesticide application, from dust and other kinds of contamination that do come from farming exercises. And I'm sure that you have a practice where perhaps you are having students work with communities. That's very, very important. I mean, you all have the expertise and the data that advocates need to present their issue in an informed way. Because, you know, most policymakers and governments think communities don't know what they're talking about. You know, they're just, and they're scared to even come out and talk to them. And so what I have found is that by working with academic institutions and having peer-reviewed data that I can talk about, especially data that comes from that community, it is so powerful. And I would just hope that you all would use your expertise to really improve what's going on here in the state. And of course, I've heard from some of your students and faculty that they're working with other cities around the country as well. There's so many communities in this country where those states are hostage to industry, where groups in those states cannot expect that they can go to their local college or university and get a fair shake, because so much money is going from industry to those colleges and to the state. And so much to the fact that some departments of health don't even collect the data and the statistics that would be helpful because the government doesn't want to know. And so again, it becomes very, very difficult for people in certain states to really be able to be proactive in their advocacy in protecting their communities and their health.
Another one, to what extent is environmental injustice a concern of national and global security?
National security.
Yes, national security.
Well, one of the hardest agencies to deal with is the Department of Defense, and they're one of the biggest polluters. They try to say that they can't give communities data on what they're emitting or where they're emitting it because it's national security. And we probably don't believe that in most of those cases. And we've got to continue to push against that. The Biden administration has made the Department of Defense subject to the executive order on climate and environmental justice, which means that they are supposed to develop environmental justice plans, and they are supposed to have programs that are covered under Justice 40. But again, as you know, none of those things happen without us holding government accountable. So the accountability is everything. And I would just hope that academic institutions are a key part of that because they have the knowledge and the expertise. But again, Department of Defense is difficult. We know that. And we know that a lot of the PFAS contamination has come from sites where the Department of Defense has facilities. We know that many of our soldiers have been, their health has been significantly impacted by emissions from a variety of munitions that are being used by the Department of Defense. But one thing the Department of Defense does understand is that climate change is an important factor and that they are taking climate change seriously. So that is one bright spot in terms of national security.
Here's one from an online viewer. Can you tell us about tools you use to make progress in resistant political environments?
The biggest tool is community advocacy and organizing. The biggest tool is elected officials hearing from people who live in their district. A lot of times when you go to lobby, the first thing, at least people in New York will ask you, officials, is what's your address? Because they want to know that you are a voter. And just to give you another example, back in the early 2000s, when we were developing a citywide lead poisoning prevention law, people thought the thing to do was to bring all of these well-known pediatricians from around the country to be on the steps of City Hall talking about, you know, what they knew, their expertise. And again, that's important. But the most important thing that moved the needle was, you know, I'm looking at all of these white groups like Sierra Club, and they're all trying to do stuff on lead poisoning. And so we joined the coalition. We said, the most important thing is to organize parents in the districts of these city council people and have those parents go and tell their story to the elected officials. And believe me, that's what made the difference. That is what made the difference. Because when you have a housing committee, the housing committee, you know, is often beholden to the landlords. And so not only was it having parents talk, but it was about having term limits. I don't know if you have term limits here, but we finally got term limits in our city council. And so that meant that the guy who had been head of the housing committee for 20 years that would not let a lead poisoning bill come out of committee was suddenly out because finally there were term limits. And then we did campaign finance, public campaign finance, which meant that any of us could get the money to run for office. And so we now have a city council that is predominantly people of color and female. And again, that would never have happened without term limits. So again, I would say the main thing is organizing the people most affected by the issue to tell their story, get them informed so that they can tell their story in a rational, data-driven way, work with them, and that really makes a big, big difference.
One more question, and this is, you know, we've met many people today, and you know many people around the country who are really engaged about thinking about the health impacts of climate change. I'd love to hear what you think we can do to make sure we ensure that any proposed solutions really are thinking about and reflecting on the needs of those who are the most affected and most vulnerable.
Well, you can never prioritize those needs without hearing from those people. And just to give you an example, Hurricane Katrina in New Orleans. Why didn't the city they had some kind of plans in place, why didn't they know that low-income folks did not have a credit card to go to a hotel? Why didn't they know that these low-income folks in the 9th Ward did not have a car to evacuate? They didn't know because they had never talked to any of those people. Those people were not on their little fancy commission on climate change or whatever they had. So again, you know, when we talk about diversity, we're talking about diversity of experience, diversity of perspective, and there's just no, you know, there's no way of getting around that if we really want to have process and policies that are equitable for all people. We can't have a just transition to renewables if that means that the 30 million households right now today that can't pay their utility bill, if they're going to be even further under, because our energy bills are going to go up for a while with this new transition. So how do we take that into consideration? You know, how do we look at really having a transition that does not have the same winners and losers? Why do we have to have losers? And that to me is really the issue. How do we craft policies with the most affected people, as well as the experts, other experts, so that we are crafting policies that are equitable and are not continuing to feed the to feed poverty and to feed disinvestment in so many communities. So we've got to have an equitable transition, and we can only do that by talking to everyone.
Thank you so much. And we could give a round of applause for Peggy again.